Thank you very much, everyone, for coming to today's webinar. I'm really pleased to be joined by Simeon and Michael from Mind's Eye Development, and they're going to be discussing the topic Health Inequalities and Community Engagement from Principles to Practice. So I'll pass over to you both. Thank you.
Hi guys, so I'm Simeon and Michael. I'm not sure if you'll be able to see him, but Michael's also here. We're from an organization called Mind's Eye Development, and our basic focus is to support the upward social mobility of young people and families within inner city Birmingham. We do this for a number of activities. The biggest one is community engagement, and we really look at supporting the community, or even supporting statutory and large organizations to engage with the community and to tap into the experiences, views and skills of the community. We also do mentoring, supporting young people, and we work across industries as well. So we work across health industries, and then also we've done a lot of work within the creative industries to support organizations from those industries to engage with the community. So we've been commissioned by Public Health as engagement partners, community engagement partners, to promote BLACHIR and the community health profiles. This has brought us into new relationships, I'd say, with the NHS and partners. Arising from that, it's given us opportunity to look at what really works when it comes to community engagement. And then it's also helped us to refine how we engage with the community and how we use community engagement as a model. Throughout this process, we've heard a number of things from the community, working with Public Health, to delivering this work for Public Health. Things such as, we don't trust the NHS. What's the point of consultations when services don't listen to us? This is just a ticking box exercise. No one ever tells us what comes out of it, and how is this going to impact my life? We've actually been asked that quite a bit throughout our consultations and our listening engagement, and it's been our role to listen to these views and feed them back to system partners to help us shape services. It's also helped us to bring the community together with system partners, which is what, from what we've seen, it's helped to build trust, develop relationships, and to support changing some of those views. Do you want to go to the next slide, Michael? You're on mute.
Yeah. Are the slides showing?
Yeah, the first one is. So we've got the first
right.
one.
Oh, okay. It's just me can't see it. Sorry.
Yeah, it's gone to the full one now. So the first slide, yeah, the first slide, the second slide, we've been looking at some of the overarching principles of good practice when it comes to community engagement, and this has been developed by NICE, who are the National Institute for Health and Care Exec, and we kind of put these up to kind of just, I'll just kind of explain how some of this has been applied. So in terms of using evidence-based approaches to community engagement, as Mind's Eye Development, we've been looking at community, we've been delivering some of this community engagement and building an evidence-based approach ourselves, and we've kind of seen what really works. But for us, it's not just about listening to the community and then feeding it back to system partners. We've kind of, this has kind of evolved, and it's really been about listening to the community, feeding it back to system partners, but then bringing the system partners around the table with the community to start looking how to address these issues, which can lead to developing services, training, and other stuff. I'll go straight down to the bottom where it says developing collaborations and partnerships to meet local needs and priorities. That's kind of exactly what we was talking about. From us just listening, feeding back, then we want to create create ways in which the system can work with the community to develop these services, develop their services. How does their services best meet the needs of the community? I'll do one more. Ensuring decision-making groups. Yeah, I'll do one more. Ensuring decision-making groups include members of the local community who reflect the diversity of that community. Now, to do this, we're not just visiting one group or speaking with one group. We've been speaking and engaging with a number of groups around the community. So we've engaged with 2 men's groups, women's groups. We're even engaging. We're planning to do some engagement with a Somali community. Go on.
Yeah.
Was you going to say something? So we're also looking to engage with the Somali community, and we're bringing all these voices together to feed into the NHS and service partners. So based on this, our objectives are to illustrate our approach. Our objectives of this presentation is to illustrate our approach to community engagement, show good practice, examples, opportunities for community engagement, and offer a flavor of what needs to be in place to achieve effective and sustainable community engagement. So I think when we're really looking at this, it's kind of what we really want to show is a way in which we have developed. We've developed a way of working which has been put into a cycle that doesn't just involve us listening and feeding back to system partners. The community need to know that they're being listened to. They need to know that what they're saying and what they're feeding us is actually making an impact, and that has brought out a load of issues and opportunities that we are moving forward with. Go on.
All right, thanks, Simeon. I think a couple of things I would just add to that, and that is to say that whilst on the one hand communities can say, well, we don't know what happens when we contribute to these processes, I think one of the things that we're experiencing, that we're seeing, is that actually even within the NHS, even when people sit around the table, quite often they don't know what's going on next door. Quite often they're not sharing their experiences, and they're not sharing it internally, and they're not sharing it externally. And then what we really want to do is to be able to highlight a number of things that are going on within the system that we think are really good practice, and not just need to be shared within the system, but actually they need to be shared externally as well, because it's all about building trust. So that's really what we want to try to do. But just to kick off a bit, because of our role is African and Caribbean communities, it's just worth understanding what that means or what the challenges are for that. And here we go. The Caribbean, 34 countries and territories, and an assortment of independent governance and sovereignties. You've got Africa, 54 countries, and to be fair, we probably all know Africa is big, but I thought, how big is it in relation to the UK? I'm thinking, would someone in Devon, if we're looking at the UK, would someone in Devon identify with someone in Edinburgh? And we would probably think not. And you've got Africa being 125 times larger than the UK. So if you like, we're talking about the Caribbean, or people from the Caribbean and people from Africa as if they are a community. But I think realistically, they're not a single community, and they're quite definitely not a single community. And as Simeon has mentioned, you know, we do try to reach out to different communities. But the point is here that when we're looking at engagement, the whole notion of intersectionality does need to underpin the approaches that we take. And I think this is the first thing for us, thinking about community. Who is the community? And then the next thing was, you know, we speak about engagement, and you know, there are lots of different theories and analyses of engagement, which began many years ago with the ladder of participation, Sherry Einstein's ladder of participation, and evolved in different ways. And you have here this ladder of co-production, and there's a lot that kind of says, yeah, you know, it can be coercion, it can be engagement, it can be co-production, it can be involvement in setting priorities, in identifying skills. But you know, there's actually there's very little that talks about the processes for achieving this. Yep, that's what it is, but little that talks about the actual processes for achieving engagement. Sorry, I think I'm right. And what I wanted to do, right? We have. Sorry, that's better. My phone's giving an echo. So we have in terms of how we work, I think we're evolving a set of values, and I'm saying evolving because this is where we are now. But over the next week or month or so, we may have more. And I don't think that these values are going to be particularly foreign or alien to anyone. But in terms of accessibility, you know, I mean, that's about time and place, but it's also things like childcare, language, travel expenses. You know, there's a lot that goes in there. Accountability is, what do we do with this information? How do we feed back to people? Equity, you know, it's about making these processes fair. It's about treating people as equals in these processes. And I know that there are people on here who are from the NHS, but you know, often when we hear about the professionals and the community, you know, some people in the community think, well, are you suggesting that if you're in the community you can't be a professional? So there's this notion of equity. Purpose is important, and that is to say that the engagement processes need to be purposeful, not just ticking a box, but purposeful. And there needs to be, you know, in terms of that purpose, it needs to be a purpose that engages all parties. People need to be treated with respect and with sensitivity, and these processes should be transparent, so that we don't hear, yes, there was community engagement, we did it last week, we didn't tell anybody about it, because that really works against this last one, which is about building trust. And so these are a set of values that I don't know if we try to put them in, or we've identified, if you like, after the fact, that are apparent in how we work, but equally and more importantly, they're apparent in some of the good practices that we have begun to see coming from or through working with our partners in the ICS and in public health. Simeon made reference to a cycle, and there are lots of process improvement cycles and stuff like that. And we really wanted to think, what does it look like for us, right? And how do we apply that? And so we've borrowed from some co-production discussions that we're involved in earlier on this year around cultural intelligence. And the thing about that is the whole process began with curiosity. This is to say, somebody is to be asking a question. Yeah, somebody needs to be curious enough to ask a question and to look at identifying a problem. But it's not enough to just identify a problem, because quite often that can focus on symptoms rather than root causes. So understanding the problem And then thinking, okay, so what are the kind of solutions, which isn't necessarily, you know, what do we always do? Do you always do what you've always done, etc., etc. But scoping the solution and think about implementation planning. How are we going to go about planning to deliver that and to test the solution? And then even when we're testing the solution, we have to have some processes in place to enable us to learn from those tests, learn from those pilot situations, and then look at standardizing that so that those processes can be rolled out more widely. And again, to continue learning. And the thing about this is that where any of these, what do you call them? They're not quadrants, that's 4, isn't it? Slices, segments. Any of them, all of them, in all of them, there is a capacity for engaging with communities. Yeah, and sometimes we hear, oh, we're not ready to do the engagement yet. And I'm saying, well, why not? How far do you need to be, you know, before you start community engagement? And what does that mean for the quality of that community engagement? So we see the opportunities for community engagement to run throughout all of this. And the point that we stress, that we repeat, is that community engagement isn't an event. Community engagement is a way of working. And that's really what we want to illustrate. And one of the things that that we should have said at the beginning is that we're hoping to go through the presentation probably in half an hour or so, and to leave some time afterwards for questions, for discussions. So, you know, you make a note, pop them in the chat, and we'll pick them up later in the presentation. Simeon.
So part of the project, BLACHIR project that we are community engagement partners for, we developed a youth council, and the youth council was really developed to give young people a voice to help shape services. So initially that looked like us having our listening, delivering our listening activities, feeding that back to the youth council, so the youth council could develop an informed perspective on what they've heard and what they've been involved in, which is then fed back to system partners and NHS. But this has evolved quite a lot, in all fairness. And the youth council have been involved in many things, such as as well as discussions with ourselves on certain issues. There's been discussions with senior partners who are involved in decision making. They've been involved in co-production, so they was involved in co-production around cultural intelligence with the Director of Public Health, Justin Varney, and other system partners. They also supported the appointment of an independent chair for the BLACHIR implementation board, and then we've also had them part of some of our discussions. So which I think we're gonna speak about anyway. We'll speak about that anyway. So we've also had them in part of our discussions, which has made a very big impact in terms of allowing some of our youth council members to engage and speak to the community, even adults of the community, and sharing their voice and opinions, which has had big impact in terms of changing the way some people from the community think, as well as helping to feed back into system partners. So the youth council has it's really evolved, and now we're looking at the youth council really deciding on the direction that they want to go in, and supporting them to do that. So as well as just being a vehicle to feed back an informed perspective, there's been many opportunities that have been created for the young people within the youth council to get involved and be around the decision-making table, and we hope for that to continue.
Yeah, and it was always important to us that when it came to young people, that no matter how much we might aspire to be young people ourselves. But it was always important to us that it was a young people should be at the table themselves. Yeah, that they should, they should be able to hear what other young people are saying and then bring their perspectives to it, and not risk having a distorted perspective applied to their thoughts. And many young people would say, well, nobody listens to us, and probably a lot more would say, we're never invited, we're never actually at the table with these decision makers. So it's been a real opportunity for us to introduce young people to that, and for us to test this model of working. But now I just want to introduce, it's a bit of a case study. There are a number of case studies that we'll share with you. And this one is, well, I mean, the person behind it is Captain Mystery, who has since left this organisation, but Cancer Partnership Improvement Manager, and she had a number of objectives that she wanted to deliver. And I just want to walk you through the process that she went through, and if you like, how communities were involved in that, how community engagement actually featured in this process. Yeah, and it began with this notion I said about curiosity and the Caribbean Community Health Profile, and data in that health profile that got Keltner thinking, is this the case? What are we doing about it? What could we be doing about it? And if you like, based on that and not having the answers herself, and wanting to engage with community, what she then did. So these were some of the findings from that community health profile. But what she did was she approached the Legacy Centre of Excellence, which those in Birmingham will be aware of. I think it's classed itself as the largest Black-run cultural creative venue in the UK, I think. If anyone's here from the Legacy, you can correct me. So she spoke with the Legacy Centre of Excellence, and she commissioned them to undertake some market testing, essentially, to go out and find out from communities, from the African and Caribbean community, what their concerns were, and if there was an appetite from the community to do something in relation to promoting awareness of cancer, of resources available to support. And that came back saying yes, and arising out of that, through another series of community engagement processes, a one-day event was organised under the title "Let's Get Together and Feel All Right." And again, the design of that event was, or in the design of that, community engagement featured quite heavily, and the event itself took place at a community venue, being the Legacy Centre here in Birmingham. Now, I mean, the event itself was very well attended, and not just was it well attended, it was well attended by if you like, the target group, but equally there was good representation there from across the NHS, different system providers coming out into the community. And it wasn't all about them providing services to the community. A lot of it was about building the relationship, understanding the needs of the target group, establishing trust, raising awareness through those conversations. Just this whole point about coming out to engage with the community, and not always, if you like, expecting communities to engage with the system. But how does the system engage with communities? And so this is what this event was able to do. And the event, there was also an evaluation then undertaken of the event to record the learning. And I really wanted to to illustrate this as a good practice, because it began with someone just asking herself a question. Yep. There was that curiosity to kickstart it. There was a degree of humility, I think, in accepting that in this case, she knew what she didn't know. And often that's not the case. Often people don't necessarily know what they don't know, but they don't have the humility to then go out and find and get answers to those questions. And that's what she was able to do. And she used community resources, including community radio, community networks, to promote the event. She used an existing platform, which was the Black Pound Day, to, if you like, to piggyback on that. And I think that it was a really good example of working with communities and the difference that working with communities can make. Simeon?
Yeah, so this was another a listening event that we had for me, which was very impactful. And this was what I was speaking about earlier, because we had one of our youth council members, Addy, as part of the panel. So this is kind of like, it was kind of like a talk show style, which we called Take Note. And this was on health literacy. So Addy, who's part of our youth council, is a third-year medical student, as well as a poet, a very talented poet. And he came on and sat down, and we had a discussion around health literacy, which kind of spiraled off and covered a range of different subjects. But it was really about hearing the voices from people from the community to find out what they knew about health literacy, some of the things that they want to see changes, some of the changes that they wanted to make. And I think if we're looking at building relationships, this is definitely one of the best ways of building relationships with the community for service partners, because even just with Addy, he's a medical student, but the community actually listened to him, and people are still asking about him now. So there was a number of things that came out of this event. The biggest one for me was around there's been a men's group that we've been engaging with around some of these issues, and they started off very negative towards the NHS service users. Like, it was hard work engaging with the lads around some of these issues, because they were just zero tolerance. They didn't want nothing to do with the health services. They were just against the NHS and the health services totally. That was their views. A few of them actually attended this event, and Addy was there, and he was talking about his experience as a medical student, and a question was asked about the relationship between the community and the NHS. And Addy just came up and just says, look, guys, you got to start trusting the NHS, start building a relationship, start having conversations with your GP, and develop that trust, because they are here to help you. Now, after the event, the person who was most volatile from that men's group towards the NHS came to me and says, you know what, I kind of trust the NHS now. And for me, that was a big thing, because there was a lot of fight from that person in particular. And just from that conversation, it kind of opened his eyes and allowed him to see, oh, maybe they're not so bad. Maybe if we start having conversations with the NHS, then things can change. Another thing that came out of the conversation was around foods. So there was we had a few nutritionists from the community that came in and said, why doesn't the NHS offer us and let us know what minerals and things that help us with illnesses come from this food? And he started to reel out a load of different foods and what comes from them that can help with illnesses. Addy, who was a junior medical student, he started to then say, oh, okay, he started to recognize what medications give you the same thing that these foods were given. And then it was like, so why can't the NHS kind of say, okay, here's this medication, but see this nutritionist as well. These are the foods that you should be eating, and really have something there that's that's something in place that's substantial that can support people getting foods, to having their medicines from foods as well as medication, because in the Black community, they're really big on food and the right foods, herbs and things like that, vegetables that can help with your health. So that was one thing that came out of it. We took it a step further, and then we met with social prescribing, and then we met with public health and food strategy. So we had a meeting with them and started to speak to them around these ideas, and then we fed it back to the community. We then fed it back to the community to say, this might be plausible. So we might be able to make something like this now, make something like this happen in the sense of social prescribing. And when our community go to the doctors as well as getting medication, they can say, okay, then see this nutritionist, these are the foods that you should be taking. And that's something that's in the pipeline, that's being developed now. Now, feeding that back to the community and back to the people that were having these views, the response that I got was, oh, they're really listening. So this is helping to build relationships. It's helping to build a lot of trust, because when people believe that they're being heard, and that's without anything really happening, just us bringing people to the table to say, okay, then can we do something? Can something happen around this? And just the fact that the people that mentioned, that were speaking about this, could hear and listen, that something could happen from it. It was like a win, and nothing has really happened yet. So I think just by letting the community know that they're being listened to and what they're saying, service providers are acting on it, has a massive impact in terms of developing the trust and building the relationship. Along with within this event, we also did a quiz, which was really kind of an imaginative way of finding out what the community knew about health literacy. So we did a quiz, online quiz, made everyone take it. We got just over 100 people to fill it out, and some very interesting data came out, which we was able to then feed back into public health as intelligence. And one of the things that came out of that, public health was really surprised that only 20% or something like that of people knew how much exercise they should do a day as an adult. And public health are really surprised about that, because they put out loads of information, or over the last year or so, they put out loads of information about health literacy, about healthy eating and exercising. So they was quite surprised that the community was unaware of this. Now, I think that gave public health the opportunity to kind of see that we put so much resources into putting all this information out, but it's not reaching the community. We need a different strategy. So just that small little quiz, which was really a bit of fun, kind of supported public health to really look and say, look, we've been doing this for a year. We put X amount of resources into getting this information out there, and the people are still not getting it. So these are the things that can come out just from small engagements with the community. Do you want to add anything, Michael?
Yeah, I mean, it really is that last point. And I think there's another point, which is about community engagement from a community perspective. Doesn't have to begin, if you like, only when the community is invited to engage with system partners. So the discussions on food that came out of that arose from the discussion initially on health literacy, that enabled us to initiate a process of engagement with providers, with the system, right? And similarly, those people who engaged or who took part in the quiz, they probably think, yeah, we're taking part in the quiz. We've got an opportunity to win £25, £50, or whatever it was. But again, it was a simple way of them contributing to and engaging in policy. So, you know, it really is about demonstrating, I think, how some of it is how easy it can be. Some of it maybe not. Simeon.
Yeah. So this here is another event that we had the opportunity to get involved in. And this actually came from the event at the Legacy. So at the Legacy, again, there was loads of engagement happening at the event at the Legacy. And I spoke with this woman, a lady called Miss Culture Jam, lovely lady. So I had a brief conversation with her in the event. And maybe a month or two later, she got in contact with me to say, Simeon, I'm having this event. I want to do something just like what was going on at the Legacy, but she wanted to do it for her chaplaincy and people who attend her chaplaincy. So we was able to support her with that, with this event. I introduced her to Dr. Anye, who is the chair of the ICS task force for BLACHIR, and Anye kind of introduced the event and Miss Culture Jam to the system partners. We was then able to invite like diabetes, people from Testicular Cancer, and a few other organizations to attend the event who also had stalls. And this was, for us on a personal note, this was really engaging because a lot of people came to speak to us. We was able to take down people's details who wanted to be involved more, who wanted to continue the conversation. And as we were speaking about some of the other projects that we were supporting around this, it just gave the opportunity for more people from the community to hear about it, but then also to get involved. Also, Dr. Anye, she met with someone from the Birmingham Hospice at a similar event the week before, and she was able to invite them to come along, and they came along and had a stall as well. So these kind of events are really big opportunities for system partners to really engage with the community, to get in front of the community and really speak. And then even with the one at the Legacy, even with the event at the Legacy, there was people coming to have their blood pressure checked. So you didn't have to go to the doctors to get your blood pressure checked. People came to get their blood pressure checked. And that was really a big one, because I've seen quite a few people really encouraged by being able to go to their local community spaces to get things done, like your blood pressure checked, speak to healthcare advisors. So it's really, these events are really beginning to make an impact and get the community more involved in these discussions. So
I think, I mean, there's another point here as well, which is that, and it's really about Anye, Dr. Okonkwo, and the fact that she went to an event on the Saturday prior to this particular event, and that's where she met people, including the representative from Birmingham Hospice. And so not only did she invite them or tell them about this particular Windrush event, but she also saw the value of engaging them in the BLACHIR ICS task force. And so now they've joined the task force. And it's not just that widens or increases community engagement, but it also brings in a unique and specialist knowledge of aging end of life care, particularly as it impacts on African and Caribbean communities. And if you like, that may not have transpired had Anye not simply attended an event such as this one here. And I think for us it was a missed opportunity, this Windrush event. It was a missed opportunity for so many system partners who could have come out, spared an opportunity on a Saturday, met with the community in terms of potential service users, as well as other agencies, some of them illustrated here, who could have been or who could yet become partners and collaborators in their service delivery.
Yeah, I just want to also say, like, when it comes to community engagement, we've really found that it's not just about listening to what people are saying and feeding it back. It's about developing that relationship and building the trust. And that's really important for us within this process.
But the last one we want to illustrate just for this section is around maternity. And again, it begins with some startling data around infant mortality, around Black women's experiences and outcomes. Maternity outcomes for Black women, and I guess many of you will be aware of them. I'm not going to go into them, but we wanted to get some up-to-date intelligence about what was going on here in Birmingham. And so we undertook a whole series of listening events. So we did 11 listening events, and we engaged some, more than 70 African and Caribbean women. We produced a report of that event, and we fed that report into a committee that has just been established, which is the Infant Mortality Action Committee, which sits as part of the ICS. Now, what that is doing just there is it's taking the voices from the community and feed them into the system. Right. But the point is that it's not enough. It's not enough that we simply do that, because as I was illustrating earlier, for us, engagement goes throughout processes. It's not just an event, it's a way of working. And so we were invited to join the Action Committee, and we facilitated or enabled some wider engagement, some wider community engagement in that Infant Mortality Action Committee. That committee has developed a work plan, which is split into 3 sections, and one element of it looks at a preconception phase. And I want to bring that up because this is a really good example of co-production now, because that committee wants to develop an educational resource. And so this is a resource that has been developed interactively through co-production. Yep. So the document is on a shared drive. Right. So members of that committee can all feed into them. I've been able to take that out and speak with people in the community, hear what they've got to say, and feed that into this process. And it really is a process of a good illustration of co-production. And it's not even just about what is produced within this document, because I know last week I was feeding something back, and even I was questioning whether the points that were being raised were based on, if you like, perception, or they were in reality correct. And the response was extremely encouraging, because the response says, well, it doesn't matter if it's perception or if it's correct, because if it's what people believe, that's what we need to address. Now, again, the point is, if people are not voicing their concerns, if people are not saying this is what they believe, then they're not feeding into these processes. And so it was a really good example of how, to my mind, of how open and inviting system partners were for engaging with the community, and hearing and encouraging the community voice and representing and reflecting the community voice in this document. And then the next stage is also furthering this notion of community engagement. We spoke about them having a work plan. What does the community think of the work plan that they've got? Even if the community agrees, how does the community then want to be engaged? And we have a conference event coming up on Thursday this week, at which, again, the system partners will come. They will present, they will invite feedback on their work plan, and they will also present opportunities for more detailed roundtable discussion, co-production discussion, to begin to inform how they can move forward with in terms of delivery on some of their plans. Simeon, I'm going to suggest that we pause here and see if there are any questions. Yeah. If not, I'll just keep going. I can't see the chat, so I don't know if there are.
I haven't. There's not as yet.
No.
No questions in the chat at the moment, but please do feel free to raise your hand if that's easier. Anyone?
Angela.
Hi, Michael. Thank you. And thank you for the input. I was just curious, given the size of Birmingham, I know you kind of reflected the different communities in terms of the African community and the Caribbean community, but Birmingham has that kind of reflection also. And I just wondered how, in terms of that engagement, you're able to do that citywide. Because I know you referenced the Legacy Centre and some of the activity that was linked to the Legacy Centre, but clearly it's a big city and trying to connect in with all the communities across that city is a challenge. And I just wondered how you were managing that.
In all honesty, Angela, I mean, Simeon can chip in here, but I'll just say we're not. I mean, we have finite resourcing, and this is something we'll come to later. So we are not truly able to get across the whole city. So, you know, we have been out and we've reached out into, you know, into West Birmingham, into Quinton, into North Birmingham, to, you know, city centre or inner city Birmingham. But also we do use social media. So social media does provide us an opportunity to widen the reach, but in terms of physically being able to go out and make those connections, it is not. It's not a question of not wanting to. It's about our own resourcing. Anything to add, Simeon?
Yeah, just that. So a lot of the activities that we have been involved in, people are coming from different areas, so they're not just necessarily coming from one area. Just for example, one of the men's groups that we've been working closely with, they're men from across the city, from different areas. I don't think probably like 2 of them are from the same area, but we've got people from down into Hodge Hill all the way to Acots Green. So it's kind of like reaching out to people, reaching out to individuals and bringing them together, and then hopefully encouraging them to share it with their family, with their friends. And then as Michael was saying, so we use social media quite a lot, and we have started conversations through social media, which then are carried into our actual in-person events. So I think social media is a powerful tool, and like the conversation that we showed that we had with our one of the members of our youth council, that was filmed and is available on YouTube, so people can put it on YouTube. We'll also be going into now doing some live streaming, which we've done before, but now we're going to do live streaming with a focus on community engagement. Now, as well as having a physical audience, live streaming some of those conversations will enable the wider community to get involved, have their say, and they'll do that by leaving comments and having the conversation within the chat and the comments, which are also moderated. We have moderators that are moderating just to ensure the safety. It's a safe space for people to share their views. So social media is a very powerful tool, and that's kind of where we're widening our reach right now based on our resources.
I think the point that you make about tapping into networks is an important one, because there is another network that we tap into as one of the groups that we go to. In fact, a couple of others. So we tap into, for example, the Council of Black Majority Churches, and so its membership is actually not even just Birmingham. It goes into Sandwell as well, and maybe a bit more. There's another group that we tap into, and its membership extends into the into the Black country. So it is fair to say that some of the networks that we have are, you know, they have the wider coverage, and we are tapping into those. It's more about our own ability to physically go into a whole range of communities across Birmingham. We just don't have that capacity.
I mean, I was just one more. When we had the event, the discussion at the Legacy, I mean, someone came all the way from Wolverhampton who had never met us personally, but they'd heard about it through social media, came down because they follow the work that we do, and they came down to get involved in the conversation. We've also had discussions where someone came from Nottingham because they've seen the conversation. So again, social media has is powerful in terms of pushing things out there and bringing people to us. If we can't go to them, then sometimes they can come to us.
Thank you.
So thanks for that question, Angela. I've just seen the time, and so if there are any questions, please do put them in the chat, because what we can't answer in the session, we can always address afterwards. I think Eloise has confirmed that there's a mechanism for you to be able to access responses after this. But I wanted to just very briefly reflect on what we think are some of the enablers for effective and sustainable community engagement. So some of it we've already mentioned around curiosity, having a vision, the humility to go out and ask questions, resilience, because if I say it's not easy, well, it isn't. But having said that, it gets easier and easier and easier. And that's because the relationships start to develop. Yeah. And so therefore it becomes easier because people know who to speak to, abandoning comfort zones and acknowledging we have to do something different, particularly in terms of working outside the 9 to 5. And going to events outside. Resources and investment. Yes, that's important. Accountability to say what came out of it, what are you doing with that information? How are you following through afterwards and being able to demonstrate there's some follow through, and an organizational culture that is conducive to community engagement, that actually gives staff the time and the support to go out and engage with communities. And from communities perspective, again, there are enablers, and you can flip it over and you can see what the constraints might be as well. But having trust, yeah, having an understanding of the issue, for organizations having the credibility, that recognition of being a trusted voice within the community to go out and do it, and operational capacity, the networks that enable communication and distribution. And this notion about imagination, we can't always be doing the same thing that we've always done. So these are some of the enablers that I think we've met. And I'm not going to say that this is all us. We're not the only ones. I mean, there are other community engagement partners, and so we're sort of drawing on that wider experience. And I think, what's it all for? What are the benefits? And it really starts at the beginning. The slide about one community. Yeah, and one size doesn't fit all. We have to recognise and respect intersectionality. It's about building trust, and it is so it's in our faces pretty much all the time. Yeah, and it was there before we had the report from the Race Disparity Unit. The fact that there are issues relating to trust, right? But you can access community assets, and when we think about community assets, there's so many of them: trusted voices, skills, knowledge, resources, networks, communication channels, reach. So there are so many of them. And further benefits, it's about conveying ownership. It's about these services being more relevant and meaningful, and being able to measure and monitor how those services are performing in ways that not just make sense to institutions, but also make sense out in the communities. Building social capital and peer support networks has already been demonstrated as being as making a valuable contribution to health and well-being. Yeah, and improving learning, and ultimately working to reduce health inequalities. So, there are real benefits here for everyone in getting it right. And from our perspective, we would say there is a lot of good practice that is there, showing how, just demonstrating it is, I won't say it's easy to get it right, but it is definitely not difficult to get it right. And it applies to institutional partners, and it also applies to communities. And I think our final message is to communities. And I think it's appropriate to sign off with a quote from Akayaba Adesebo. And he was at an event I was at a couple of weeks ago. And in his speech, he made this comment: "It's your space, take possession of it." And that really kind of hit home with me, because it says to us as communities, yeah, there is that space for us. We need to take possession of it and not necessarily sit and wait to be invited.
Yeah, bro. Let me add, because just for the system partners and people working within the services, like if you really want to change the way people think or the way service partners and organizations are seen, community engagement is very important. Like it literally, I've seen it happen in person. It changes the way people think.